Welcome everyone to today's webinar, How Dedicated MRI for Weight-Bearing Imaging Improves Patient Care. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few housekeeping instructions. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm pleased to welcome today's speakers. Cesar Cuevas, Chief Executive Officer and President of STAT Diagnostics. He offers over 20 years as an entrepreneur in the orthopedic industry. He was born and raised in El Paso, Texas, then moved to Houston in 1997 and founded OrthoMed. OrthoMed is an orthopedic medical surgical device company that services Texas, Florida, and Nebraska. Throughout this time, he has been a strong supporter of the American Academy of Orthopedic Surgeons and the North American Spine Society. He has been involved in multiple startup companies, such as hospitals and ambulatory surgical centers, and played an intricate role with the marketing and revenue cycle teams. He founded STAT Diagnostics in October 2018 and has brought weight-bearing mass MRI to the Houston Metroplex area with great success to the community. Dr. James Lynch from Spine, Nevada, Reno. Dr. James Lynch is a board-certified neurosurgeon with 25 years of experience specializing in complex spine surgery, cervical disorders, degenerative spine, spinal deformities, trauma, tumor infection, and minimally invasive spine surgery. Dr. Lynch has been performing minimally invasive spine surgery techniques since 2002. He's one of a handful of spine surgeons with 3 fellowships in the specialty of spine surgery. Known as a national leader in outpatient spine surgery and minimally invasive spine surgery, Dr. Lynch regularly presents at regional and national conferences. He is the founder of Spine Nevada Minimally Invasive Spine Institute and IXE Healthcare Group. He also serves as chairman and CEO of IXE Healthcare Group in Spine Nevada. Dr. Lynch and Cesar, thank you for being here today. Dr. Lynch, I will now turn the floor over to you.
Thank you for the kind introduction, Mary. Thank you, Scott, and the Becker team for allowing me this opportunity to discuss how weight-bearing MRI improves patient care. I'm a neurosurgeon in Reno. Advanced imaging is very critical to our care, and I'd like to share our experience for the last 6 years with InMotion weight-bearing MRI. I have no disclosures pertinent to this talk. Spine Nevada was founded 16 years ago. It encompasses a comprehensive group of neurosurgeons, physical medicine doctors, physical therapists, in-motion diagnostic spectrum of imaging, a full radiology suite, in-office injection suites, and now added Swift Orthopedic Urgent Clinic and Spine Nevada Direct to our IXE group. Our parent company, IXE Healthcare Group, was really founded on the philosophy of innovation, patient excellence, and continuous evolution in technology. And indeed, the Esote weight-bearing MRI just fits perfectly within that. It's a natural fit to our practice and our patient care. And evolving technology is just part of our DNA. As we see here, comprehensive network and building that, as quoted here, long-term success will be attributed to patient culture, a physician-led culture of quality care at the right place and the right time. If we extrapolate from the CMS quadruple aim here of better outcomes, patient experience, and reduced costs, we're a value-based framework here at IXE Healthcare, really looking at reduced costs, improved outcomes, and overall our goal is to elevate the consumer healthcare experience and ultimately the patient feedback and the patient care. I use a Hollywood Squares analogy here. I've been using it for several years to educate our staff and our providers and indeed sometimes our insurance partners as to how we set about our philosophy in the practice when we do investments, when we open a new office, we open a new technology line. And so everybody is familiar with Hollywood Squares, whether it's David Spade in the middle here or Whoopi Goldberg, controlling the X in the middle is very important, and controlling the corners. So how do we get there? If satisfaction for the patient is the important goal, you need to control the corners. So if we look, number one, paramount thing I believe is access. We need to have excellent access for the patients, multiple offices in different locations geographically, and an ease of access to our office. Low cost of care is critical, and how we go about that, and we'll expand upon that. We've been publishing outcomes, our own outcomes, for the last 16 years, probably 10 years ahead of CMS discussion on patient satisfaction scores. You don't have any business discussing quality unless you can produce outcomes, and we've been doing that. And ultimately with the goal of increasing patient satisfaction and therefore patient care. If we look at access, we've developed Swift Orthopedic Urgent Clinic for our orthopedic needs, and in addition to Spine Nevada Direct for our spine needs. On those two sites, they have MRIs, the Isote G scans at each facility, and on-site physical therapy as well, in addition to the urgent clinic with full radiology capacity. Patients like it. It then translates to improved access and really lower cost of care compared to going to a hospital or ER or a hospital urgent care. It's defined care, it's orthopedic, spine-directed care, and this leads then to the need for imaging, which we can really provide to them efficiently and optimize their experience. Outcomes, as stated, we published our outcomes for the last 16 years, and patient satisfaction scores is very important in delivering the highest quality. Quality is just a part of our whole belief in our organization, from the offices to the technology, and really just the whole patient experience, from the staffing and the education and the really delivery of care for the patient. It set us apart in the region with a unique technology, and really the Isote weight-bearing MRI technology has been a game changer in our community. It's very much differentiated our practice from our competitors. Patient satisfaction, without question, has been improved over the years, and paying attention to that, and delivering a really nice MRI platform to the patient has been kernel to that. Whether it's the regular MRIs comparison, patient experience is far better. The feedback has been much improved, and the experience they've had with our Geo MRI, and many patients have several MRIs so they can compare and contrast the whole experience. It's not just the technology, but also the delivery of the care and the lower cost. William Mayo, the senior Mayo brother, discussed the best interest of the patient is the only interest to be considered. And this was 1910. This was drummed into us as Mayo Clinic residents. And it's interesting when we see this. This is really, over a century ahead of patient-centered care. So really what he was saying was put the patient in the middle, and everything about the patient is the most important thing. So what he was describing was patient-centered care. And we look at patient-centered care provided by Pickers and the Harvard group. Really, it's listed here in a line: respect for patients' preferences, meaning nice, efficient access to imaging. In this scenario, drive up MRI. They don't have to go through the hospital, getting lost in a car park, valet their car. They come in, it can be very relaxed in the environment. It's not threatening. Tube of terror is kind of removed in this MRI. And really, it's a more positive experience, and therefore, better patient outcome, we believe, better value, better quality, in addition to better coordination, integration of care overall for our clinic to our radiographic studies and our higher end MRI imaging. Patient comfort is essential in the whole experience. We pay a lot of attention to that. And emotional support, it's a stressful time getting an MRI on the day, but there's a lot of stress before that, but it's the cost. So walking the patient through that, the fact that we have this in-office MRI system in our practice, we can really control the cost. We can control the communication with the patients. They're not going to get these exorbitant bills. We tell them what their copay is, their deductibles, where they are, and really the cost of the MRI is considerably lower than a hospital environment. We bundle the cost of the MRI, so the cost and the radiology read is bundled together, so it's fully transparent, and the patient doesn't end up with exorbitant and surprising bills. Continuity, transition of care then, the MRI can be done oftentimes in the same day as the clinic visit. We're in Reno, Sparks, and Carson. We serve a whole northern Nevada community, so with outreach and transport, oftentimes the patient doesn't have an MRI, or indeed a poor quality MRI or an old outdated MRI, And oftentimes we can accommodate them on the same day of their visit when they come here to have the MRI. This has worked out very well for our community. And access to care, as we've already spoken about, is critical. So we try to follow these principles. These were newly published, but we've been following a good set of these for years. We took on the challenge and really embraced the challenge of creating a unique platform of imaging. And we created the InMotion Diagnostics platform. And we believe it's truly the most advanced imaging center in the United States for detecting motion in the spine. And that's a big ask, big reach, but we believe we've achieved it. We have two Sote G-scan MRIs. The first one was installed in 2014. The second one was installed in 2016. We added the O-scan extremity MRI for our sports medicine patients in 2018. In addition to using the G-scan Brio MRI, the weight-bearing physiological movement MRI, we also pair that and partner that with the vertebral motion analysis and really studying the whole kinetics and the motion of the spine. I believe that gives us higher degree of information on foraminal stenosis and compression that otherwise we would have missed in a standard MRI. We also take this into account when we're performing more complex deformities, and it's really heightened our expertise and our experience that we can provide to the patient. In addition, we have full body digital scoliosis bending films, the standard, and this whole experience we can deliver to the patient in a very seamless manner. A patient experience goes towards the patient outcome. It's not what we tell the patients that matters in outcomes. It really is the patient experience and how they tell us what their outcomes were. They're grading us, we're not grading the patient. So we need to really reach out to the patient, provide the best excellence in patient care from the phone call, the initiation, setting up the appointment, and then to the entry in the office. The environment has to be welcoming, warm, inviting, and clearly relaxing. If you're doing MRIs, patients come with all sorts of stress, apprehension, and if you can mitigate that and reduce it in the environment, and I think like everything, showing a high degree of quality in your office, higher technology, that just reassures the patient. That can be translated across your organization for sure, and the staff understand what the expectations are, and if we can continue to foster those, we're in a better position to meet the patient's needs and improve their patient outcome overall. The MRI plays a very critical role in separating us from other delivery care in the community, and it's been something that's been very beneficial. We've been fortunate to have great partners with Sote. Our 6-year-old and 4-year-old Geo MRIs and indeed the O-scan, no technical issues whatsoever. They're basically computer stacks that get serviced out of hours. We've had no downtime or any related problems with them. Patients' feedback has been extremely positive throughout. I had an MRI myself, was my shoulder, shows a rotator cuff tear. The experience was just, pretty much fun for me, I suppose, but just putting myself in the patient's shoes, this wasn't a tube of terror. I've had other MRIs in the tube for various other body parts, and it's not a nice experience. So the original TikTok of the MRI, closed tube of terror. So this is a very good experience for musculoskeletal, spine, and indeed other joints. Advantages here, again, positive patient experience we've seen throughout over the last 6 years. Access is key. We can facilitate the patient. We're really defining the imaging for spinal motion, we believe, and the direct impacts on the nerves that we see in that physiological loading of weight bearing. Most spinal hardware can be scanned without metal artifact, and we have full capacity with our PAC system, and this really complements our whole imaging platform. Plenty of research study out there showing the positional changes, increased disc size, and we see this on a daily basis as we look at it. Essentially, to summarize, while this is beyond the remit of this talk, weight-bearing MRI may increase the diagnostic sensitivity of nerve root compression. We see this. This helps and guide our interventional radiologists, interventional pain management physicians for guiding a placement of needles and accurately defining the pathology, and it helps for our surgeon planning as well. Indeed, plenty of studies of that disc herniations. We'll show a video of that. This shows the O-scan MRI, very relaxing environment. In fact, this is my wife, Caroline, having a latte and a phone. I asked her to do that, but she's having an ankle MRI there. And, this is totally alien experience to a standard traditional MRI in the environment. And it really has proved to be a game changer for us in the community. The vertebral motion analysis just really complements the whole system. Again, warm, inviting, high-tech environment. Patients understand quality. If you provide it, they react to it, they tell their friends, their neighbors, it really is, and more importantly, social media, I suppose they tell everybody. Digital x-rays, again, has to be high quality if you're going to do it right. The field strength, I look at the MRI, and definitely if you're doing brain or lung or breast or cardiac studies, a higher magnet MRI 3T would be important for that. But really in the spine, the mechanics are important, and the way and it's more critical than the signal itself. So the way I like to look at that, standard traditional 1.5 3T MRI, while higher in field strength and maybe slightly higher in resolution in certain instances, that's a static image in time. So I like to compare that and say, look, the static image in time is like looking at a waterfall. You can take a photo of the waterfall, or you can take a video of the waterfall. I believe the Asote G-scan is the video of the waterfall. It gives us more of a dynamic look of the waterfall. We can interpret it better, and in correlating with MRI, we can diagnose more accurately and better define the problem. And I think that helps us be better physicians and better spine providers in general. That's been our experience. We've been very happy with the imaging throughout. If we look today, the overarching goal of healthcare organization is to improve the clinical outcomes without further encumbering the cost of operations. If we can do that, our MRI, if we look at outpatient MRIs, our MRI is much cheaper than the hospital's MRIs across the board. Insurances are very in tune with this. Optum came out recently and they stated that outpatient MRIs were essentially saving 62% compared to hospitals. Anthem insurances in many areas are refusing to pay for the site of service differential for a hospital-based MRI if it can be readily accessible as an outpatient. So I think this is the trend in the future. And I think having outpatient, nice accessibility and lower cost is really important, and it drives the technology and the need as well. I'm going to show you a little video here of our MRI in motion. I made this in 2015, and we have a load of these videos on discs and lumbar stenosis, just showing the weight-bearing component. The patient has a supine MRI, and then they can be rotated standing. Oftentimes the patient's actually too painful to lie down, so they actually like just starting with the MRI standing up, and then this really gives us good information. We look here at the supine MRI. You see the compression of the disc resulting in nerve root compression, fecal sac compression. In addition, there's more enhanced lordosis, and a result, the spinal canal gets more narrowed. The foraminal height compresses down. And so this is a lot more information that we see compared to trying to interpret standard static supine MRI. Plenty of case studies here showing heightened disc herniations with the weight bearing. The classic thing is, you don't hurt when you lay down by comparison. In general, you hurt when you stand up and you load the disc, and we see that time and time again. I think this is very important to see this lateral disc here. We also see foraminal closure being more pronounced on MRIs when we study it. It's important that your radiologist is a neuro-trained radiologist who's used to interpreting dynamic MRIs. I think if somebody's going to have a local radiologist interpret it, he has to get some experience and looking at case studies with the technology rather than a standard non-dynamic MRI they're used to. This spinal stenosis is shown up here. The area of the spinal canal is reduced significantly here in this study, 121 millimeter total down to 37. We see that the spondylolisthesis and flexion extension MRI is more pronounced. Advantages in cervical are similar overall. We've been very happy with that. Flexion extension reveals more soft tissues, disc herniations that we wouldn't see. Oftentimes I can rule out a disc at the level above an intended index fusion to say, look, it's performing well. I don't have to include that. That's very important for the patient overall and the insurance and the better outcome. Again, spinal cord compression, we see that now. Even though there's CSF in front of the spinal cord, there's contouring or concavity of the spinal cord. That's just the dynamic part of the MRI showing the disc pushing against it that you wouldn't experience or see in a traditional static MRI. Overall, I think 20 to 30% significant abnormalities are seen more on the weight-bearing MRI compared to static traditional MRIs. Again, the experienced patients love it. The physicians that refer to us understand it. We educate them. We can better plan for their treatments. And you do the right procedure at the right time in the right place, and everybody likes it. Key to our success is really education, educating our patients, number one, educating our providers in our practice, educating our referral sources, and importantly, educating our insurance groups as well. thank you for your time and attention. We've got some minor tenets. We've talked about the major ones: access, again, cost, outcomes, quality, and patient satisfaction. But I'll leave the minor tenets: communicating with the patients, both digitally and important. And then consumerism. The patients will tell you what they choose and what they want to do, and they will really, embrace this technology and move forward. So again, thank you very much for your time and attention.